It's day 3 here in Washington at TCT, and I'm Peter Block for On the Scene. The whole issue of what to do with in-stent stenosis is a problem, and with me is Fernando Alonso from Pamplona, of all places, where you run with the bulls. And so we're going to hear about an interesting trial of a drug-eluting balloon versus stent-in-stent. So, Fernando, tell me what your trial is about.
Okay, so this is a trial comparing the best strategies for patients with drug-eluting in-stent restenosis. This is part of the RIPS program, where many university hospitals in Spain, 25 in fact, are working together to address this problem. So in patients with drug-eluting in-stent restenosis, we just compare the use of drug-eluting balloons, and we use the Sequent Please, as compared with a second-generation drug-eluting stent. And in this regard, we use the everolimus eluting stent, the Science Prime. And we randomized 309 patients that were allocated to these two strategies.
So the drug-eluting balloon is sort of a hot topic. Everyone was hoping this is going to be a great new therapy that would be easy and not leave anything behind. Tell me what you found.
Okay, well, this is a great therapy, but our results suggest that the minimal lumen diameter and other surrogate angiographic endpoints at 6 to 9 months follow-up were better in the everolimus eluting stent arm. And we also found, even though our trial was not powered for clinical events, we found that the TLR and the TVR clinically indicated was also lower after the use of everolimus eluting stents.
So that sounds like a pretty clear-cut victory for a stent-in-stent solution and strategy for in-stent stenosis. Is that right?
Well, I mean, with the perspective of our trial that was not powered for events, the answer is you're right. This is a clear victory of everolimus eluting stent, but I think there are many issues that we need to take into account, and also I think it's very important to keep in mind that drug-coating balloons actually work in patients with in-stent restenosis. And if we compare the data we got now with those when you use conventional balloon, the response regarding minimal lumen diameter and the late loss, they are markedly improved as compared with other therapies with these balloons. So I think there is plenty of room for drug-eluting balloon in this setting.
Okay, so let me ask you the final question. If you had a stent in your right coronary artery and it became stenotic, what would you like to have?
Okay. If there are no issues of concern regarding the prolonged dual antiplatelet therapy, if I'm not concerned because there are multiple stent layers or major bifurcations, I will use everolimus eluting stent.
Thank you. So there's the answer to the question of how to strategize dealing with in-stent stenosis, but the interesting thing is that the drug-eluting balloon also works, and it probably, as a technology, is not yet finished. So thank you very much.